Our next presentation has the title, Grace and Goodbye, Redefining End-of-Life Care for Children with Terminal Illnesses. Please welcome Dakota Prindle.
I would do anything for them. These words are spoken by parents across the globe. A testament to their boundless love and sacrifice. But what if I told you that in the relentless fight to extend your child's life, you may be causing more harm than good? A terminal diagnosis is devastating, and in the desperation to save their child, parents often lose sight of what they truly need: peace, comfort, and dignity. The fight for life can turn into an unintentional prolonging of suffering. At what point does treatment cease to be a gift and become a burden? Consider the case of Benjamin Hawks, a 10-year-old boy diagnosed with osteosarcoma. He had undergone several rounds of relentless radiation and chemotherapy. When doctors informed his parents that treatment was ineffective, they decided to bring him home to undergo palliative care. Rather than suffering in a hospital, Benjamin regained some strength and lived 7 additional weeks surrounded by family, laughter, and love. Thanks to palliative care, his final days were not marked by sterile hospital rooms and invasive treatments, but by comfort and quality time with his loved ones. Palliative care is often misunderstood. It is not about giving up hope in the face of death, nor is it synonymous with hospice care. Rather, it is a holistic approach to prioritize quality of life, ensuring that a child who has a serious illness will experience his or her final days full of peace, love, and dignity. It provides relief from physical pain, emotional distress, and spiritual suffering to allow children to experience peace and joy in their final days. Although some would argue that choosing palliative care for minors with potentially terminal illnesses is morally wrong because you are willingly allowing a child to die, I believe palliative care is a justified decision. Today, I will argue that parents should embrace palliative care because it improves quality of life for their children, strengthens and supports families, and aligns with the Christian values of faith and acceptance. A child's terminal illness does not only affect them, it devastates the entire family. Parents struggle with unbearable stress, siblings feel bewildered and neglected, and the family as a whole is shaken. Palliative care provides essential emotional, psychological, and spiritual support to the entire family. Research shows that more than half of families with a critically ill child suffer from post-traumatic stress disorder, generalized anxiety, or depression. Palliative care teams offer spiritual guidance, practical support, and grief counseling to help these families work through their grief in the face of an unimaginable loss. Moreover, palliative care respects the parent's role in decision-making. Rather than medical professionals taking control and dictating every aspect of care, parents are actively involved in creating a treatment plan that aligns with their personal values. For many families, faith plays a crucial role in how they approach suffering and death. Christianity teaches that life and death are in God's hands. Ecclesiastes 3:1-2 reminds us that for everything there is a season, and a time for every matter under heaven, a time to be born and a time to die. While modern medicine often views death as something to be fought at all costs, Christianity sees it as a tragic transition where we are reunited with Christ. Palliative care does not deny the value of life. Rather, it acknowledges that there is a time to let go and entrust a loved one to God's plan. Palliative care encourages patients, as well as their families, to further their spiritual journey. Families facing the impending loss of a child often experience a crisis of faith, questioning why a loving God would allow such suffering. Palliative care provides spiritual support through counseling and chaplain services to help families work through this grief in light of their faith. Rather than isolating families in their sorrow, it can strengthen their connection to God and remind them that even in the midst of suffering, He is present. In Philippians 21:4, Paul writes, "For me, to live is Christ, and to die is gain." Paul recognized that death, while painful for those left behind, is not the ultimate defeat. For believers, it is the beginning of eternal life with Christ. Palliative care is compatible with this belief in honoring the dignity of the dying. It allows children to pass away in peace, free of unnecessary pain, surrounded by love, and most importantly, in a way that honors God's timing. Some critics argue that palliative care contradicts the ethical duty of doctors to save lives. The Hippocratic Oath, which has guided medical professionals for centuries, includes the principle, "do no harm." Opponents of palliative care worry that shifting the focus to comfort measures is in essence abandoning a patient to die. This concern is understandable. Medicine is built on the idea of fighting disease and preserving life. However, true healing is not always about extending life at all costs. The principle of non-maleficence, or avoiding harm, also means recognizing when continued treatment causes unnecessary suffering. There comes a point when aggressive medical interventions do more harm than good, leaving patients trapped in an endless cycle of pain, exhaustion, and hospital stays with little to no hope of recovery. Palliative care is not euthanasia. It does not hasten death. Instead, it allows doctors to care for the whole patient, body, mind, and soul. It ensures that when a cure is highly unlikely or no longer possible, the patient's final days are filled with peace and dignity rather than unnecessary torment. The American Medical Association acknowledges this, stating that physicians have an obligation to transition a patient to palliative care when further treatment is futile. Additionally, medical ethics acknowledges patient autonomy, the right of individuals and their family to make informed decisions about their care. Palliative care honors this in giving parents the choice to prioritize comfort without pressuring them to stop treatment prematurely. This does not take away the doctor's duty to heal. Rather, it redefines healing to mean relief when a cure is out of the picture. Ultimately, palliative care does not violate medical ethics, it upholds them by respecting the balance between preserving life and preventing suffering. Pediatric palliative care is not about giving up. It is about making every moment count. It allows children to experience peace and love in their final days and supports families through an unimaginable loss. Death is an unavoidable part of life, but suffering does not have to be. Pediatric palliative care offers a compassionate path forward. Let us embrace palliative care not as a sign of surrender, but as a way to love more deeply, cherish every moment, and say goodbye with grace.